Prior to use, unscrew and remove cap. Discard the white ring below the cap and replace cap, screwing this down to fully pierce the container. Remove cap for use. Sometimes it may be advantageous to warm the solution to body temperature, as cold cleansing solutions cool down the wound bed. In wounds with poor circulation, which is typical of chronic wounds, it may take a couple of hours before the wound bed has maintained body temperature again. In this time, the physiological wound healing process is delayed or inhibited. Remove the old dressings. If encrusted or sticking to the wound, the solution can be used to pre-soak and loosen the dressing. First, irrigate the wound using the solution to loosen surface debris and assess the wound. For larger wounds, soak gauze pads with Prontosan wound irrigation solution and apply to the wound for 15 minutes or according to your local protocol. Remove the Prontosan soaked gauze by irrigating the wound and lifting away from the wound. This will help to remove any surface debris, slough, bioburden and biofilm. Record date opened on bottle and discard any unused solution. The solution can be used alone or followed by Prontosan wound gel or Prontosan wound gel X, which can be applied to the wound bed to help maintain an optimal wound environment until the next dressing change. Squeeze the container to create a gel coating on the wound that is at least 1/8 of an inch to 1/4 of an inch thick. That's about 4 to 8 millimeters, filling any cavities. For deep and tunneling wounds, wound cavities, as well as difficult to access wounds, it's best to use Prontosan wound gel, whereas for larger surface area wounds, the viscose gel X may be preferable. A secondary dressing should then be applied over the gel. This should be selected based on the type of wound, where it is, and the level of exudate.